I am State Representative Dagmara Avelar, and I am the co-chair of the Illinois Legislative Latino Caucus. And I'm proud to stand here alongside my fellow legislators in the Illinois General Assembly to provide a response to the governor's budget address earlier this afternoon. As a Latino caucus, we have been listening to our communities, to the stories of our communities, and using these moments to drive us, the 17 Latino members of the Illinois General Assembly, to roll up our sleeves and get to work on behalf of Latinos across Illinois. Our community has always been resilient, and together we will continue working to ensure that we have the resources to not only survive, but to thrive as a community. It is out of this shared experience that the caucus continues to work on Raíces, a Latino-based framework that reflects the major equity issues for our community and that drives our work. The Raíces framework represents the legislative and budget priorities that came from you, our community, including health equity, protecting immigrants and language access, education equity, economic equity, and representation. Today we heard from the governor regarding his priority investments, and while his budget proposal is a good starting point for further negotiations, we are looking forward to increasing investments in Latino and immigrant communities. There are many aspects of this proposal that the Latino caucus supports and have the potential to really make a difference in our communities, such as the Ready to Renew campaign, in addition to the Care Portal and Home Illinois. Moreover, our state is in a much better financial place. We have been paying down our debt and building our rainy day fund, which means that the state is in a position to deliver for the people of Illinois. And Latinos are a big part of the state. In his remarks, the governor said, "We don't hide from the truth, we embrace it." And the Latino caucus believes that every resident of this state has the right to health care. Illinoisans, as individuals, as employers, as taxpayers, have experienced a rise in the cost of healthcare and coverage in the recent years, including rising premiums, deductibles and copays, restricted provider networks, and high out-of-network costs. Businesses have also experienced increases in the cost of healthcare benefits for their employees, and many employers are shifting a larger share of the cost of coverage to their employees or dropping coverage entirely. And that's just not right. Healthcare providers are also affected by inadequate health coverage in Illinois. And we will work significantly to expand healthcare access because we believe that every single Illinoisan, regardless of status, we need to establish protections for those that don't have current healthcare, have it, again, regardless of immigration status. We also want to make sure that we establish protections for those with medical debt and those eligible for financial assistance. Currently, many of our communities are dealing with mental health incidents that are materializing themselves through violence. A major reason why the encounter persists is the lack of preventative care and identification of mental health illnesses. And instead of addressing the illnesses, the state relies on incarceration and as a short-term solution. And that's also not right. We need to have an expedient approach because the current expedient approach that we have, it's wreaking a havoc in our communities. To create a safer Illinois, we must remake our mental health apparatus so that it centers on the needs of patients while enhancing public safety. Public safety is a public health issue, and continued investments in violence prevention programs are critical to our communities because healthy communities make for safe communities.